Right, I think I have started. I just recorded three, or up to now, two papers or two little reports about clozapine in schizophrenia, mostly about the effects and the side effects. I would like to mention about how to start and stop clozapine, because this is usually a bit of a drama in the hospitals. In many places, not Germany, but England, clozapine has to be started in the inpatient hospital. And usually, if not, then you have to have regular monitoring. So, as I said before, and there must be something like patients must be monitored with a specific service, which could be the Clozapine patient monitoring service, or Denzapine monitoring service, or Zaponex treatment access service or system. So everybody has to be registered, starting usually in hospital. And the major side effects, as I told before, is the suppression of white blood cells and neutrophils. And in this respect, it would be recommended, or it's necessary, that that patients have a leukocyte count of more than 3,500 millimole per cubic millimeter, 3,500 per cubic millimeter, or neutrophils 2,000 in the same area of volume. So this should be fine. And so the blood levels should be fine. The treatment, so the blood should be stable. And usually when the medication is started, there's continuous monthly blood levels of white blood cells. If there's problems about compliance, one can do serum blood levels of clozapine, but that's usually a bit more difficult to get. It's getting more and more common. Usually one starts very low. As I said before, clozapine is a very sedating medication. One would start at 12.5 or maybe 50 milligrams or 12.5 twice a day. Then it's gradually increased very slowly in step of 25, later 50 milligrams over 2 to 3 weeks. And usually there is an average dosage which should be given. And then at this dosage, one would wait a little bit. The question is the severity of the symptoms. If you have very severe symptoms, you go higher. If you have very tolerable symptoms, maybe hearing the odd voices but not being affected too much, then clozapine 200 milligrams might be a decent dosage. Later, it can be increased by 50 to 100 milligrams, maybe weekly. Usually, I say I'm not totally clear about that, because it depends very much about the response of the individual patient about that. So then, if you're on the right dosage, one can then see whether the symptoms wane. Sometimes, there are less dose or lower dosages proposed for the elderly. Not totally sure why lower doses should work. There's a bit of a discussion about that. But in general, the recommendation is that older people should have less medication. Females sometimes need less, and as smokers, usually the higher dosage, and non-smokers respectively lower dosage. Right, we have discussed about the contraindications or the interaction of other medications. Sedating medication should be avoided in clozapine. Clozapine is very sedating and can make very sleepy. It can cause heart problems. So in case patients with heart problems, it's not really recommended. Right, if there's a break of the medication of more than 48 hours, one would usually start from square one, which is a bit sad, but that's what it's about. Right, usually if everything is fine, then usually one doesn't have to do too much, it's usually checking the white blood cells, and if you can afford that, the blood levels. If you have neutropenia, you should stop the medication as soon as possible, depending on the severity. So these abnormal hematological results are the most common indication to stop the medication or bring it down quite considerably. Other side effects might when you start the medication, require a little bit of a slower increase. But if the side effects like sedation doesn't go off after a more slow increase, then clozapine is not indicated. So infections are important. If you have reductions of white blood cells, and if you have time to discontinue clozapine, if you don't have any leukopenia, then you should usually gradually discontinue the medication. Reason being that in many patients you can have a rebound of psychotic symptoms like paranoia, hearing voices, or aggression. So in this respect, you wouldn't want to reduce the medication too fast. Usually, as clozapine has cholinergic effects, fast discontinuation could produce a rebound and cause profuse sweating, headaches, vomiting, diarrhea, or nausea. So in this respect, if you can, get the medication off slowly. So this is what I wanted to say about the starting and stopping clozaril in schizophrenia, and I hope it helps. It's not an individual recommendation, but a general overview. If you want more information, don't hesitate to subscribe to our YouTube channel, to the Psychiatry Archives. Thanks a lot, and I hope you're doing all right, and all the best. Thanks a lot, and thanks for your interest.